Hi, good afternoon. Thank you for coming to our open house. And today's sharing is going to be about what speech therapy is about, how it is more than just words, but also about why this career is so rewarding as well. So when you hear of speech therapist, naturally the word speech makes you think of how we talk, right? So that's why most people, the public, will think that we are working with how to get people to talk a little bit better or more clearly, right? But our full title in Singapore should actually be speech language therapist, right? So that adds a little bit more information to what we actually do. Okay, we are not just working on speech. We work on something even bigger than speech, which is language, and you will get to know a little bit more as I talk further. In some other parts of the world, so I was trained in Canada and the US, and in UK, they actually use the term speech language pathologist, right? But it is a mouthful, right? Speech language pathologist, right? So we can see why people in Singapore don't really want to use it. But I actually feel it is the combination of speech language pathologist and speech language therapist that really gives us our identity, right? Because in pathology, you are looking to assess, identify disorders, and that's what we do. But at the same time, after we've done that, we treat people in these disorders, right? And that is being the therapist. So actually, a better label that we would actually identify with would either be speech language pathologist or speech language therapist, right? So if people keep saying, oh, speech therapy, I hope at the back of your mind you're thinking of this longer term of speech language therapist. But even then, this is not going to be sufficient, as you will see. So as speech language therapists, we are actually in a very unique field because we work a lot with the sciences, right? So we learn a lot about our anatomy, our physiology, neurology, how the brain works, how the body works, right? How development happens. But at the same time, we also learn a lot about the arts, right? So you have to have a good grasp of linguistics, right? Which is the area of the study of language. So as speech language therapists, we also are very well versed in, our grammar rules, which is actually in linguistics, we call it morphology, right? So how do we know we add on ed for past tense, right? Things like that. We have to study semantics, which is the understanding of word meanings. We study phonology, which is speech sounds, right, in a language, and combinations of those speech sounds in language. And we study pragmatics, right, which is the use of language. And that includes syntax as well, how we form our sentences, how they come out. So this is a combination of science and arts. So if you're a student who has never been sure whether you love the sciences or you love the arts, this is actually the career for you, right? Because it blends the two together. And you need to have a firm grasp of both in order to practice as a speech language therapist. So now that we've gotten over this terminology and the labels that we have, I'm going to share a little bit more about what we actually do. So we don't just work with a certain population, right? Or only children, only adults. We actually work across the lifespan in all three areas of speech language therapy. So the first one is the most obvious, speech, right? If you've ever tried tongue twisters, have you ever tried tongue twisters, right? And if you struggled trying to get the words out accurately, that's kind of part of speech, okay? So from young, we work with children who have articulation difficulties, right? So these are the children who might say, instead of fish, they will say bish, right? Instead of finger, they will say finger. Or they might say, instead of daddy go, they would say daddy do, right? So certain kinds of speech sounds are produced inaccurately. So that would be from young, right? So we see children with articulation disorders. And then in the older adults, we see older adults who have an acquired neuromuscular speech disorder, and which we call dysarthria. Okay, so this is when They might have certain brain injuries, and then they end up having difficulties either from the brain producing the words or certain muscular issues, right, that involve our articulators in trying to produce the speech sounds correctly. And then in between, we actually work with a lot of specialty areas as well, right? So there can be speech disorders to do with cleft palate, cleft lip. We have specialty areas in stuttering, and we have specialty areas in voice. So in teachers, right, who have overused their voices, singers, right, who have voice issues, or even children who have abused their voice, right? They love to scream and shout, and then they have a hoarse voice. They actually come and see speech language therapists as well, right? So it is across the lifespan. There are different types of speech difficulties that can occur, and we as speech language therapists work with all of this, right? So it's not just stuttering and it's not just talking clearly. The next big area is language, and this is actually my area of specialties. It can take months or years to actually work through. But from young, right, we have language delay. So you might have parents who are concerned, oh, is my child is not talking at 2 or 3 years old. So we work a lot with parents at this stage to do some language stimulation and to address the delays in language development. Then as they get a little bit older, we have school-age children who have, they might be developing normally in all other areas of development, but somehow having specific difficulties in learning language. So we do work with school-age children in language learning difficulties. And then as they get even older, so in adolescence, right, in their teenagers, we might actually work with them in higher order language skills, things like reading comprehension of longer passages, narratives or storytelling, and even conversational skills as well. So across from language delay to school-age language learning difficulties to higher order language, we also work with those in the special populations, right? The children with special needs, children or teenagers with special needs. So for example, those with intellectual disability, with Down syndrome, with cerebral palsy, or on the autism spectrum disorder. And then what happens? It doesn't stop, right? Even though language development is kind of done by the time you reach adolescence, but there can be acquired neurological language disorders in adults or older adults, right? So in aphasia, that is when the adult had a stroke and then they had language difficulties following the stroke. But you can also have traumatic brain injuries from blunt force trauma to the head or motor vehicle accidents or degenerative diseases like dementia. And that can lead to cognitive communicative disorders. And so we will work a lot with other allied health professionals, with the caregivers. We work a lot with the families in order to help rehabilitate their language difficulties. And finally, the third area of speech language therapy is swallowing and feeding. So I'm really glad that there's somebody in the audience who actually said chewing and swallowing, because this is the area that is often unknown to the public, right? They don't realize that we actually look at swallowing and feeding as well. And again, it is swallowing and feeding difficulties can happen across the lifespan. So in babies, right, premature babies, infants who have problems sucking and swallowing, speech language therapists actually work very closely with parents and other medical professionals to help them learn how to suck and how to swallow properly. And then as they get older, this one, please don't come and look for us as much, okay? Fussy eaters, right? A lot of parents, and we do help with fussy eaters, right? So it might be linked to certain sensory processing disorders, right? So speech therapists, we actually do help parents and work with parents in order to address this very frustrating issue of fussy eating. And then into adulthood, what we have, again, following certain neurological or certain medical issues, they might have swallowing disorders, which we call dysphagia. And so it can be due to stroke, once again. It can be due to head and neck cancers. It can be due to other issues with aging. There are aging-related or other medical issues. So what happens is that the person isn't able to swallow safely, right? So we want to check as speech language therapists, we check, are there certain muscles that are weak? Are there coordination issues such that when the person is swallowing, things are going down the wrong pipe? So I hope you can see that speech language therapy is really more than just working with talking, working with words. It is working in all these three areas. And speech and language together actually form the basis of communication. Right? So somebody mentioned at the beginning as well, working with communication. And that's a very important part in quality of life, because it is in communication and the ability to exchange information with people that we have that social interaction that happens in society. So talking a little bit about the program we have at SIT. So in SIT, the program trains our students in all of these areas across the lifespan. So you will learn about all of the speech, language, and swallowing disorders in children, and the speech, language, and swallowing disorders in adults as well. A good thing about studying in SIT is that right from the beginning, you actually have interprofessional exchange. So in the first few years, you are actually learning alongside the other allied health professions in the sciences. So you'll work with students who are learning to be dietitians, occupational therapists, as well as physiotherapists. And then after you learn about how the body functions, how development occurs, so there will be lectures and seminars, which is very typical, but those only form a subset of the types of classes we have in SIT, because there is a lot of team-based learning and problem-based learning. So after you learn all the theory, all the knowledge, right, we put them together into case studies, and the students together will work through case studies and apply that knowledge. And there are a lot of practical classes as well, where you will work not just with simulated patients that you see down here, but also with actual patients as well. And of course, our faculty, we are actually all experienced clinicians on faculty. We also invite a lot of senior clinicians in the industry as well to come in and teach certain core classes. And so after learning all the basics, then we come to how we assess and diagnose across the lifespan. Right? We can use low-tech and high-tech tools, so the students will learn a wide variety of tools. We will learn how to do oromotor assessments, pen and paper tests to assess speech and language. But we also teach the students how to use the high-tech tools. So if you look at this X-ray, so it's actually an X-ray of swallowing, and it's called video fluoroscopy. And we can actually look at the person eating in real time. So this is actually the side profile. So this is the throat. And so you can see as the person is swallowing all that black stuff, this is supposed to go behind, which is the esophagus. But when it leaks to the front, that's how we can see objectively that the person is not swallowing safely. Students will also learn other high-tech tools, like what we call the fiber endoscopic examination of swallowing. And so we teach students how to do the scope, how to look at it, how to interpret and see whether the person is swallowing safely or not. And finally, of course, after we teach the students how to assess, identify, and diagnose all of these different types of disorders. We, of course, have to teach them how to provide intervention and treatment. And this is done in a variety of settings, right? So we have students, we first teach them, okay, all the different issues related with specific settings, right? But they also have 5 blocks of clinical placement education, which we call CPEs. So those are placements in clinics, in the industry settings, where students will have to complete the 5 blocks in a variety of contexts. So it will be with a mixture of children and adults. Some of the students go into our mainstream preschools. They might work in nursing homes, community settings, both pediatric and adults, as well as in the hospitals as well. So all students will have to go through working with children and with adults and across a variety of settings. And of course, because this is, where the unique thing about training in Singapore as well is that throughout the curriculum, throughout the program, we will actually emphasize certain unique things that we need to consider for our local population. So certain ethical, cultural, or professional issues will be addressed throughout the modules in order for us to work most effectively with our local population. And that is why speech language therapy is a career that is truly beyond words.